Hi, this is Ruby Bolster.
And this is Frances Griffin.
We are occupational therapists in the outpatient clinic at Craig Hospital in Denver, Colorado. Today, we are discussing techniques, equipment, and environmental setup to facilitate childcare for individuals with spinal cord injury. This disclaimer is to recognize that parenting is a very personal journey and that every individual has their own style and preferences. We recommend referring to the American Academy of Pediatrics for current safety standards and recommendations.
This is a chart that we use to loosely guide our practice in terms of identifying skills that individuals with certain spinal cord injury levels should be able to access solely based on their muscle picture to help guide expectations and set goals. Some patients may do more and some may do less depending on a multitude of other factors, including family support, access to supplies, and personal desire to perform above listed goals. We usually ask our patients who are parents or who are becoming parents to think about the top priorities and goals, as these will be different for each person. Here is the same chart enlarged to give you a better idea of what types of childcare abilities individuals may be able to perform and what equipment might be indicated based on functional muscle picture. For example, someone with a C6 functional muscle picture would have wrist extension, elbow flexion, and shoulder flexion, which would enable them to perform tasks such as holding a bottle, feeding a child solids, and transporting the child in their wheelchair. Here's the remainder of the functional abilities by level chart. Generally, the more movement someone has, the more likely they will be able to participate in childcare activities using off-the-shelf products that do not require further adaptation.
In today's presentation, we will cover the following childcare activities: mobility and physical closeness, that is techniques for holding, carrying, lifting, and transporting your baby. And we will also cover equipment recommendations and techniques for feeding, diapering and dressing, bathing, sleeping, play, and safety. At the end, we will share some helpful resources that can be used for networking and further research.
The first area of childcare we're going to go over is mobility and physical closeness. When holding, carrying, and lifting your child, there are a few things to consider in terms of safety for both the child and the parent. For the parent, things to consider include how your balance may change with the added weight of the child, how carrying and holding a child may affect your posture, and what pressure changes may occur on your cushion and how this will affect your skin. It is important to have a secure method for holding and handling your child, especially if you'll need a hands-free option so that you can push your wheelchair. Baby wraps and carriers are a good place to start for a hands-free option. There are many options on the market today, but a few things you might think about before making a purchase include: are you able to manage the closures? Do you have shoulder or back pain that would be exacerbated by wearing a certain carrier or wrap? Look for options that have front closures and those that spread the pressure out by way of larger, flatter, and softer straps over the shoulders. There are other options for carrying and transporting baby, including lap belts that accommodate a child sitting in your lap. Using a carrying basket placed in your lap can be useful for short distances with a smaller baby. A draw sheet, blanket, or scarf placed underneath your baby can also assist with positioning and picking up, putting down your baby more easily. When picking up and putting down your baby, make sure you are as close to as possible to the surface you are transferring them to or from to optimize safety, increase stability, and reduce risk of accidents or injury. Let's talk about car seats and strollers. Consider looking for a car seat that is a lighter weight to make easier transfers into and out of the car. There are options for car seats with a swivel base on the market, such as the Cybex Serona, but they can be fairly expensive. For individuals with limited hand strength, there is a buckle release tool that can make popping open the car seat button a little easier. Infant bucket car seats can be a nice option due to their compatibility with many strollers, saving you some extra work by reducing the number of times you have to transfer your baby in and out of a seat. As for strollers, considering the compatibility with an infant bucket car seat would be a good place to start. Look for strollers that are lightweight and easy to maneuver. Some manual wheelchair users utilize a Smart Drive power assist to aid in propelling while pushing a stroller longer distances. There are some do-it-yourself ideas online for making a wheelchair-compatible stroller, but there are limited options on the market right now. For older kids, the use of a stroller board, like the buggy board, where a standing child rides on a board mounted to the back of a wheelchair could be one option. Next, we'll go over some strategies for breast and bottle feeding. The use of a bottle warmer to warm up formula or breast milk bottles can reduce the risk of burning yourself in attempting to transport hot water. Keep in mind that the accessibility of the turn dial when shopping for options. Some are easier to manipulate with reduced hand function than others. Using an adapted universal cuff on a bottle can help with bottle feeding and positioning as pictured. These are fabricated in-house by our sewing volunteers, but there are some options on the market, such as the U-Adapt, that would play a similar role. Using pillows such as the Papi or My Breast Friend can be useful in positioning baby for bottle feeding. Have a plan in place for how you will manage burping the baby, or have a support person nearby if you're unable to do this safely on your own. Prepare the environment ahead of time with cleanup supplies so they're handy when needed. If you plan on breastfeeding your baby, there are many positioning options suitable for those with limited mobility, including recline, side lying, and supported sitting positions. Again, using pillows to optimize the support for you and your baby. For a recline position, you can elevate the head of your bed if that is available, or prop yourself on a wedge, pillows, or the armrest of a couch. For side lying, you can feed the baby both breasts on the side you are on by using pillows to support the baby's head for the top breast and allowing the mattress to support them for the bottom breast. Next, we'll talk about feeding solids to a baby. Here are a few equipment considerations for the high chair. Ensure that the high chair is at a height that allows you to reach them easily from your wheelchair. Look into high chairs that will accommodate your wheelchair sitting close by in terms of the angle of the legs and where those will meet your wheelchair. The closer you can get, the more easily you'll be able to transfer your baby in and out and help them with the feeding process. Ensure that you're able to access the safety straps and tray mount release easily. Some find it easier to avoid chairs that have individual leg holds for the baby, as this makes the transfer in and out slightly less complicated. Encourage your baby to assist with self-feeding when they are able. Plan ahead when gathering supplies for a feeding session. Extra utensils, food, and towels will come in handy if and when those items end up on the floor. Using a silicone bib with a food pocket to catch extra food is also a convenient option. Keep in mind that a high chair can also be a good activity station for various crafts and sensory activities and can be a nice way to engage with your child in playtime. A note on safety: if you are planning on feeding solids to your baby and have limited strength, coordination, and dexterity, please ensure that you will still be able to perform emergency choking intervention and CPR should this occur, or have a support person nearby who can perform infant CPR and choking intervention if you are unable to do this on your own.
Next, we will talk about diapering, starting with the environmental setup. When choosing a changing surface, consider wheelchair accessibility and your ability to get your knees under the changing surface. To achieve this, you could use a desk or a height adjustable table with a changing pad on it. Depending on your balance and stability, you could also use a couch, bed, or even your own lap as a changing surface. If you are using a changing pad, look for a style that has padded walls to assist with your baby's positioning. Some changing pads come with a safety or security belt that is attached to the changing surface, or you can place shelf liner or Dicem underneath the pad to prevent it from moving while you're changing the baby. You can also consider a changing pad with a waterproof cover for ease with cleanup. Planning ahead and organizing the space in advance will also help with this activity. If you are using a changing surface that does not have shelving, you can use a shoe organizer next to the changing table for easier access to necessary powders, creams, diapers, and clothing. Baby wipe dispensers can be useful if you have limited finger dexterity. Finally, you can use a musical mogul over the changing surface or toys to distract and engage the baby while changing. Careful attention to clothing selection and clothing adaptations can be helpful for people with limited hand function when it comes to dressing the baby. When selecting clothing, look for clothing with zippers, which can then be modified with a loop, or clothing with no snaps. If you have finger dexterity but reduced strength, consider using secondhand clothing so closures are more worn and easier to manipulate. Once your child has adequate head control, many parents with spinal cord injuries swear by overalls, which can be used to get a secure hold while lifting and transferring the baby. Examples of adaptations include replacing snaps and buttons with Velcro or magnetic closures, adding loops or rings to zippers, and using cloth diapers with loops added to the tabs. Loops can be made out of softer material like electrical tape and string. Children can learn to assist with diapering and dressing by lifting their bottom. You can cue the baby by gently tapping their bottom and giving the verbal cue up or lift. If you have reduced balance, strength, or coordination, you can reduce lifting demands by having baby roll to their side while dressing instead of lifting their legs. Parents with spinal cord injury often report bathing as the most challenging childcare responsibility due to the safety concerns of handling a wet and slippery baby. However, there are several techniques that can facilitate safety and independence with this activity. Using a baby bathtub is a good starting place for many parents. These are typically hard plastic tubs that have a sloped, textured surface or sling that keeps the baby from sliding. Consider a baby bathtub that has various seating options to accommodate the baby as it grows and is able to sit with some support. The baby bathtub can then be positioned on an accessible table or counter for more ergonomic access. Dyson or shelf liner can be placed under the tub to prevent it from moving when bathing your child. A wheelchair accessible bathroom or kitchen sink can also be used for bathing, as seen in the top photo. Sinks can be slippery, so consider lining the sink with a clean towel. When it comes to transferring the baby in and out of the sink or tub, some additional strategies may be required in addition to those mentioned earlier, due to the baby being naked and wet. The baby can be wrapped in a towel for the transfer, which can also provide some neck support. As a child gets older and more mobile, they will likely start using a standard bathtub. For parents with the ability to complete uneven transfers independently, you can transfer to a step stool or an intermediate surface next to the bathtub. This allows you to get closer and lower than the wheelchair for easier access to the bath. Another safety consideration is planning ahead. Gather all supplies prior to starting so that the child is never left unattended during the bath. Have a basin of water, a damp washcloth, multiple dry towels, and anything else you might need within reach before you begin. It is also important for the water temperature to be warm, but not hot enough to cause burns. If you have impaired sensation in your hands or arms, consider checking the water temperature on a part of the body with intact sensation. For example, wet a washcloth and test the temperature on your cheek if that area has intact sensation. There are also baby bath thermometers that can quickly read the water temperature. When it comes to sleeping setup, one group of options are bedside bassinets and co-sleepers, as pictured in the top photo. They give infants their own sleeping space, but keeps them in arm's reach, eliminating the need to transfer out of bed for feeding or to comfort your baby. The bassinet walls protect the baby from parents' loose bedding and rollover risk. It is important to note that the American Academy of Pediatrics recommends room sharing over bed sharing. If you do plan to do bed sharing, consider your spasticity patterns overnight and areas of impaired or absent sensation. Portable cribs, also commonly known as pack and plays, are another group of options. Some have a side zipper that can facilitate access from a wheelchair. Most have a bassinet attachment at the top that can be used as a sleeper in the early days. With this setup, the baby is higher up, so they are easier to reach. Another benefit of portable cribs is that they are travel friendly. Some parents prefer to use a standard crib. Like portable cribs, most standard cribs have a high mattress setting that can facilitate reaching and lifting your baby from a wheelchair. As babies learn to roll, sit, and push up, the mattress needs to be lowered. At this point, consider the height and sturdiness of the top rail. Many parents will use the top rail to brace their arm or upper body for balance and stability when leaning forward and reaching. There are also many creative modifications to standard cribs that can be found online. Some parents have modified their crib to have a sliding gate or to be elevated for easier access from a wheelchair, but please note that this goes against current safety regulations and will void warranties on equipment. Finally, there are a few cribs on the market that are designed specifically for parents with disabilities. PDO-Lift is an electronic elevating crib, and the Guri crib is designed for wheelchair accessibility. They tend to be very expensive, which is why we offer this other suggestions as listed above. There are many, many ways to play with your baby, no matter your level of injury. Story time, singing, movies, and play groups with other parents are all great options. When it comes to your baby playing with toys and interacting with their environment, the location may depend on your physical abilities and preferences. If you can pick baby up off the floor or from the bottom of a crib, you can use a play yard, pack and play, or plastic corrals as a play area. Other options include setting up a baby gym or a play mat on a couch or bed to reduce the demands of lifting baby from a low surface. Please note that baby should not be left unattended if they are on a couch or bed. If you choose to use a bouncer or a swing, consider models that have a more open base for wheelchair access when transferring baby. Also consider the overall height of the bouncer or swing. The lower the model, the more difficult transferring the baby will be. Finally, we will discuss some safety considerations not already covered in the other slides. For crawling and toddling children, provide physical boundaries to keep them away from danger and to contain them in a place where they can be supervised. Playpens, like the one seen in the upper picture, are often modular and more panels can be added to create a larger play space. Portable playpens can serve a similar function, especially for younger children. The AAP recommends baby safety gates on stairways and doors to protect mobile babies from injury. Baby safety gates can also provide boundaries for a play area and prevent them from entering rooms that are not child-proofed. When looking at baby safety gates, consider wheelchair accessibility. Look for models that have an opening wide enough to accommodate your wheelchair and ones that do not have a threshold that would interfere with your wheelchair casters and wheels. Finally, when child-proofing your home, magnetic locks do not require as much dexterity.
Here are some of the many online resources for parenting with a spinal cord injury. Thank you for your time and happy parenting.